TPA is tissue plasminogen activator, and it was put on the market, studied in the mid-90s for treatment for acute ischemic stroke to help try to restore blood flow to blood vessels that were blocked in the brain. And it became FDA approved with the first pivotal trials back in the 90s. There's been some barrier to use, and part of that is comfort level of physicians in administering this drug that can cause intracranial hemorrhage. But also a big barrier to the use of it is patients getting to the hospital on time. You know, they have to present within the first couple hours of their stroke treatment to be eligible for TPA. So at St. Luke's, first of all, we were in the original trials, and then we don't have barriers to using TPA. Our emergency room doctors, our emergency room staff, the neurologists, we're all in on this, right? We want everybody that possibly can to get treatment for an acute ischemic stroke to get the treatment and to get the standard of care. So we have Dr. Sportis' new tool, the Resolve tool, that helps practitioners maybe that aren't quite as comfortable to use it to be more comfortable to use it, to be able to talk about it with the patients and the families.
So this is a very exciting time in medicine today because we're starting to engage in something called precision medicine, which is trying to personalize treatment to individual patients. And one of the really exciting areas to do that is in acute stroke treatment, because a stroke is a devastating, catastrophic obstruction of blood flow to the brain. And there are drugs like TPA that can dissolve that blood clot and restore blood flow to the brain and minimize the damage of a stroke and allow patients to return back to work as opposed to having devastating disability and being in a nursing home. And at St. Luke's and the Marion Block Neurosciences Institute, we've been really aggressive leaders in stroke treatment for about 20 years. And over the past 4 to 5 years, we've been collaborating with colleagues at Tufts and UCLA to develop a precision medicine tool to allow emergency room doctors to know for the patient before them how likely are they to have a good neurologic outcome with TPA versus without TPA, and what are the risks to that patient if they do or don't get TPA, because sometimes patients who get TPA can have a bad bleed in the gut or in the head, and so you want to tailor the treatment to those who benefit while not giving it to those who harm. And so using a number of clinical trials, we were able to build a prediction model that uses 6 very simple characteristics: the patient's age, the severity of their stroke, when their stroke occurred, their blood pressure, their diabetes, and their glucose level, to predict whether they're going to gain a lot or not gain a lot from getting TPA.